Here we go. So my name is Chloe Gordon, and I want to introduce you to my colleagues who are going to be helping me during this webinar today. We have Alvin Hartono.
Hi.
Sophie Pirondet. Hi, everyone. Dr. Nikki Dos Ramos, who's going to answer more of your clinical questions, and Shivani Singh, who's going to be manning the computers. So we're going to break this podcast, webinar into a few different parts. We're going to talk about the tools you need, how to set up, how to take photos, how to load it into the hub, and then how to talk about the dentofacial or the mock-up with your patients. So before we jump into it, we should probably talk about what is a dento. And you see I've shortened it up because dentofacial analysis is a bit of a mouthful. So a dento is essentially an extraoral evaluation tool that's used to assess the tooth and the soft tissue relationship. It's also great for tracking your patient's oral health progression, and it's a great tool to communicate your anticipated outcome of your treatment plan with your patient and your lab. And if you present it well, it'll help you sell more too. And then since we're on the topic of dentos, I wanted to bring up the digital treatment simulation image, which I'm going to call a mock-up, because it uses similar techniques and really similar photos. So a mock-up, as you probably know, it's a visualization of the finished outcome of the treatment plan on the patient's image. And if presented well, it can be a theatrical review of the final outcome to your patient right there during the first visit. And also it gives your patient more confidence and emotional confirmation toward the treatment plan and you. So some really good benefits or some really simple tools. So I'm going to pass it over to Alvin, who's going to walk you through how to get started. Alvin?
Thank you, Chloe. Hello again, everyone. Welcome, and thank you so much for joining our webinar. I'm really excited to see on our list here that we had a lot of familiar faces, but I was also really excited to see a lot of new faces too. So again, thank you so much for joining, and I'm going to be telling you a little bit more how to take good photos, what you'll need, and the whole setup process. So first off, I'll run through a few of the things that you'll need to get started. So you'll need a device to take some photos. So that could either be a smartphone, as long as it has a camera, or you can use a professional camera here. So here I have an Android. You can also use an iPhone, but I also have here a Sony mirrorless cameras, but DSLRs work great too. Second, you'll need a pair of Koi's facial reference glasses. So this is what they'll look like here. So you'll place these onto your patient, and what this does is help keep it's a good reference point for our designers. What's special about these glasses is that they have two level indicators here, one here and one here. So what this does is when you're balancing, there's an air bubble that goes to the center if it's balanced, and that's how you know they're level with the eyes. You'll also need a cotton roll. So what this does is you'll put into the patient's mouth in the back, and they'll lightly bite down, and that's how they keep their mouth open. But you'll also need a cheek retractor. Great, so to get into the setup process, first you want to find a white background or a wall. As you can see behind me here, we have a brick one, so we don't have a white wall. A backdrop will work great, just like this one. And so what I'm going to do is I'm going to invite my colleague Sophie, and she's going to be our patient today. And so get your patient to either stand or sit in front of the white backdrop and center them. And then the next thing you want to do is you're going to take the facial reference glasses. And the patient's going to put it on. So once she's put it on, as a dentist, you're going to be helping her realign them and make sure they're balanced. So as I was saying before, there's two level indicators here. So realign them and just make sure that the bubble on both of them are in the middle. So you can tilt their head a little bit if you need to, but as long as they're both level, that's great. So one of the questions that you guys ask is, for example, if you're wearing the facial reference glasses, and you're taking multiple photos, is it really necessary for them to stay perfectly still and for you to take the photos from the exact same position? That's an excellent question. So a quick tip that we've been told too is if you lean back against the wall or have the patient lean back against the wall, that helps them keep perfectly still. But if you even have a foam cylinder, you can also put it on behind their neck and they can lean against that. Another great way is if you have a tripod, you can put your camera on the tripod and then you have to worry about moving the camera. It'll stay in the same position. However, we do understand that not everyone has a tripod or a camera like that, or they don't even have a foam cylinder. So again, like I was saying before, we try to make this as accessible as possible for everyone. So the most important part here for our designers to do excellent work is ensuring that the glasses are level. So again, it's the level indicators. So for example, if the image is slightly different or if they move a little bit, our designers can always fix that image and make sure the image is upright. So if you're watching this webinar on your screen, think of it this way. If you take your phone or your screen and you flip it upside down, all you have to do is rotate it back and the image stays the same. However, if the components of the image changes, for example, the reference glasses, if they're tilted, it'll be harder for our designers to do their work. So just keep that in mind. So next, I'm going to invite my colleague, Dr. Nikki Dos Ramos, and she's going to grab a retractor, and she's going to help the patient insert it into their mouth. And then she's going to take a cotton roll and she's going to place it in the back of their mouth. And the patient will lightly bite down. And then realign the glasses if need be. Lastly, you just want to double check that the room has enough lighting. So just make sure your lights are turned on, or if you have a window next to you, keep that open. This just ensures that the quality of the photos are top notch. So now you're all set up. And then the next step is taking the photos. So what I'm going to do here is I'm going to pass Nikki my phone. And she's going to, what you want to do is line up your camera or smartphone just about 3 to 5 feet away from the patient. For you photographers out there, if you enable a 3x3 grid setting on your camera, the reference point, it's a good reference point when you're taking your photos. So taking the top horizontal line and aligning it with their eyes and the fins of the glasses, that works great. But an easier way to remember is if you zoom in just enough that you see their mouth, but you leave enough space around the face, so above their head, below their chin, and beside both of the fins of the glasses, that's enough space for us to work with. So the first photo you need to take is the retracted one, which we have here. And then the second photo is the repose. So she's going to take out the retractor as well as the mouthpiece, the cotton roll. And so for the repose, what we usually say is we get the patient to say the word or name Emma, and then hold the mouth position at Ma. What this does is it's, the lips are in a relaxed position.
Emma? Emma.
Great, and the last photo you need for the dentofacial is the Duchenne, otherwise known as the exaggerated smile. So get the patient to laugh or smile as hard as they can. And what's important here is that we see the top teeth as well as the bottom teeth. So if you're also ordering the smile mock-up, an extra photo that we suggest taking is just a regular smile. And that's it. Taking photos is as easy as brushing your teeth. So now that you all have all your photos, depending on the equipment you have, you can transfer the photos onto your computer. So for example, if you have a professional camera like a DSLR or a mirrorless, just take out your SD card, plug it into your computer, and then drag it onto your desktop. If you have a smartphone, what you can do is you email the photos to yourself onto your computer, and then again, dragging onto your desktop. So the next step is getting the photos onto the hub, and I'm going to pass the torch to Chloe, and she's going to be teaching you how to upload the photos onto the hub.
Thanks, Alvin. So on my screen here, you can see that I've logged into my hub account, and I'm going to scroll down to the patient that I just took the photos for. So I'm going to click into Sophie. I am going to scroll down and click on the clinical photos section. I'm going to create a new photo set. And what's great with the hub is this first section here, the facial reference glasses photo series, has all the photos you need for the mock-up and the dento. So I'm going to pull up my photos and you can see that I've selected the view where I can actually see the whole photo, because it's tough to know which photo is which when you're just looking at the file name. So it's really easy. I'm just gonna drag and drop the photos. Into the hub here. And they really quickly upload. So you create photo set. Click cancel because we already have that photo set right there that we can use. And you jump over quickly to the treatment cases. And this is where you're going to submit a new case. And here's where you're going to click design. You're going to select what you want to order. And because we took all the photos, let's do a dento and a mock-up. And both of these are offered through the Coist Digital Design Center. And with the mock-up, we do ask for a few other pieces of information so we can customize the smile to what your patient would like to see. You select it, you can add any notes, and you click next. And the system pulls the necessary files that we need to do the dento and the mock-up. So I'm going to submit it, and there you go, off it goes. And you'll get your dento and your mock-up back within 1 hour if you order between Monday and Friday, 9 a.m. to 4 p.m. Pacific time. And when it does come back, you will get an email notification, and it'll direct you to go back into the hub so you can then download the dento and the mock-up, and then from there, present it to your patient. So I'm going to pass it over to Dr. Nikki, who's going to talk to you about how you can talk to your patient about these two products.
Thank you, Chloe. So hi there again, everybody. There's usually going to be two scenarios. The first scenario, patient's going to have made the appointment knowing that they want to have their smile redesigned or they want to have some aesthetic work done. The second scenario is going to be a patient that's just coming in for their annual or biannual clinical examination. I think with both appointments, it is invaluable to take these images in any case as part of the checkup. With scenario one, you can immediately say to the patient that you're going to be submitting this to the hub, and you're going to be getting back your dentofacial analysis and your smile mock-up. And you can get the ball rolling from the onset. With scenario two, you might need to make a follow-up appointment with your patient and then say to your patient that you've taken the liberty of having the dento and the mock-up done and discuss the images, see where the patient would like to make changes, resubmit it to the hub if needs be. But it's a nice open way of discussing it with the patients and a great visual aid for your patients. The other thing that we've had are some dentists that have emailed the images to their patients after they've received it from the hub. This is a very nice way. You can email it to your patients, and we've had great feedback from the patients. It also gets the ball rolling straight away. But this is pretty much how you would do it in clinical practice. Thanks, Chloe.
Thanks, Dr. Nikki. So you can see that it's pretty straightforward on how to take photos for the dentist and the mock-up and submit on the hub. So if you have any questions for any of these sections, anything at all, please email them to us. Reply to the email that you just got with the and we'll get back to you today on that. And, so if you're watching this, that means you got the email and it included this recording. And the other attachments are a one-pager of the Dento and the mock-up that you can print off so you can use for a quick reference guide. And then finally, we want to offer you a free Dento or a free mock-up so you can test out the skills that you learned today. But the catch is that you have to submit it by end of day tomorrow. So if you want the free case, you have to do it by end of day tomorrow. And that's so you practice right away and you get comfortable with the techniques that we talked about. So again, any questions at all, please respond to the email. And then also any feedback at all on the content of this webinar. If you'd like to do some more, we're going to sort out the technical issues, and we hope to talk to you guys again soon. So on behalf of Evident, we want to thank you so much for taking the